everybody, my name is Kata Della Torre, and I will be doing my PowerPoint on the legalization of medicinal marijuana. Medicinal marijuana, also known as cannabis or hemp, there are two different types. Hemp is more known for its recreational use, while cannabis is known for its medicinal use, and it has 5 to 10% more THC for the recreational uses, which is what gives you that high feeling that marijuana is well known for. There are 483 compounds in marijuana, and 83 of those are known as cannabinoids. So, cannabinoids are known as go through a system, and they're known to help with the immune system and restore the immune system. There are numerous types, and marijuana has been the one to really help with the finding out what those types are and which ones interact in our body. Here you can see a couple of the points in our body where the cannabinoids interact, and they really help make our cells a lot healthier and restore the immune system. So there's a lot of commotion about marijuana and whether or not it should be used, whether it should be legalized for medicinal use. And I think we will get to a point where it will get to be legalized in all 50 states. And the reason is because marijuana has actually shown to reduce cancer. It promotes the cell death specifically of cancer cells and nothing else, which is completely different of what chemotherapy or other cancer drugs do. What marijuana does is reduces the blood supply of the cancer cells and therefore kills them through isolating them. It does not damage any of the normal cells, which is what is so great about it. And in studies, such as this one right here done with liver cancer, it was shown to completely cure cancer of 25 to 35% of mice. And the study has been done with several types of cancers, so it has shown great promise. And if we continue to study the drug, it might even lead to an even greater solution to this problem and the disease. One important note is that it is only effective when digested, not smoked. So, like I said, marijuana is only legal in 23 states and not here in North Carolina. But I am here to explain a little bit as to why it should be. Not only is marijuana being researched for curing cancer, it's also a great treatment for some of the symptoms of cancer, AIDS, glaucoma, epilepsy, anxiety, and a couple of other things like multiple sclerosis. While the main problem is the dosage, the great thing about marijuana is that it stimulates your appetite, especially of these patients that have these diseases. It helps with emotional effects, and there are some physical side effects, which is another potential problem that we could cure. A little bit on the background of medicinal marijuana, or just marijuana in general, is that in the 17th century it was actually encouraged to be grown in the United States. When Mexican immigrants started migrating to the United States, they introduced this recreational use. And after the Mexican Revolution and into the Great Depression, it actually caused fear because it started leading to prejudice, and they started correlating marijuana and immigrants with violent behaviors. And the government created fear, and people created fear, and this is why they started banning the use of marijuana. In 1932, the Marijuana Tax Act was passed, and a national propaganda campaign was what created even more fear into the drug and as to some of its uses. So, some of the arguments against medicinal marijuana is that it robs users of their free will, that it is a gateway drug, that other drugs are present to cure some or to be used in the same way that marijuana is used, that it impairs driving, and that it has a lot of medical risks. But I'm here to rebuttal that and explain why it should actually be legalized, at least for its medicinal use. So the first argument was that it robs users of their free will. Yes, this is true for recreational marijuana. As I stated at the beginning of the PowerPoint, medicinal marijuana has less of the psychoactive cannabinoid, THC, that will reduce the effects of that. And not only to say that, but to add to the argument, there is another drug, also known as K2, or synthetic marijuana, that is legal in all 50 of the states, and it has the same side effects. So if that drug is illegal, why can marijuana not be legal? Secondly, it is a gateway drug. Caffeine has been shown to be more addictive than marijuana, so that cannot be true. They say that there are other drugs present, yet Marinol, one of the drugs used in cancer patients to treat the appetite, causes nausea, and then you have to give a drug for that to treat those symptoms, and that has other side effects. So it doesn't do the same thing that marijuana would do. So if we have a drug that treats everything right at our hand, why would we not use it? They say that marijuana impairs driving, so does alcohol, and yet that's legal. Not a valid argument. In addition, they say that there are medical risks with using marijuana, yet there has been so many positive health effects that have been shown to the use of medicinal marijuana. So that's another reason that it should actually be legalized. So in conclusion, marijuana can actually be a great medicine for the treatment of many things: glaucoma, AIDS, help cancer patients, and could be a potential cure for cancer. It actually started out as just an illegal prejudice against Mexican immigrants. So the reason that it was initially illegalized was invalid to begin with. And it has so many uses, and there's no real argument against it, that we should really think about legalizing it. So these are my works cited, and thank you for watching.